Hello my dear friends, I am Dr. Arun Swami. So in this video we will discuss about the chemoreceptor and the baroreceptor physiological part, how they actually functions, what is the importance of this receptor and their reflexes. So let's talk about one by one both the receptor and see few MCQs how the question can be asked in the different examination. Now, so let's talk about the first of all the chemoreceptor. Guys, chemoreceptor. So as you can see over here, this chemoreceptor, this is actually the chemical sensor. ये कुछ नहीं है बेटा. सिर्फ this is the sensor, like the sensor we are having in our mobile, na? Like this in this mobile we are having. So like the same way, these sensors are actually present in our body, and basically they regulate something inside of our body. So chemoreceptor is basically the chemical sensor. Now, what is the function? The function is it detects the changes in the oxygen, CO2, hydrogen, and it regulates the respiration and the CVS. How it's regulate the CVS and the respiration, we will see further. There are two type of chemoreceptor in our body. So kindly focus on this part. Two type of chemoreceptor. Actually, this type on the basis of their location. That the receptor which is present outside of the brain we named as a peripheral chemoreceptor, and the receptor which is present inside of the brain we called as central chemoreceptor, right? Central chemoreceptor. So you can see over here, suppose this is your aorta. देखो बेटा एक बार इधर देखते हैं अपन, ये जो है ये है आपका aorta, right? So few receptor is present inside of this aorta, and this aorta is divided, and this is going your carotid artery both side, right? Right and left carotid artery. So another sensor is present inside of this carotid artery. So basis on this, the receptor which is present inside of this artery we called as carotid chemoreceptor, and the receptor which is present over here in the aorta we called as aortic chemoreceptor. Both they are situated outside of the brain, hence we named as a पेरिफेरल कीमोरिसेप्टर. तो पेरिफेरल कीमोरिसेप्टर में कितने हो गए बेटा? दो. विच वन? नंबर वन आयोटिक एंड नंबर टू इज कैरोटिड. देखो, दीज आर द सेंसर एंड एवरीथिंग इज एक्चुअली रेगुलेट बाय द ब्रेन. तो ब्रेन को कैसे पता चलेगा कि व्हाट एक्चुअली दीज सेंसर्स आर गेटिंग टू नो? So what is happening? God is actually connected them, both this receptor, this chemoreceptor and this chemoreceptor, they connected via the nerves. So the nerve which is connecting the aortic baroreceptor, this nerve is actually the vagus nerve. And also the nerve which is connecting the carotid chemoreceptor, it is your glossopharyngeal nerve, and the both connection of this chemoreceptor, they are actually connected inside of the medulla, right? So medulla is actually regulate it. Now let's talk one by one. So first of all, the peripheral chemoreceptor. So as just now I told you, the location, the first chemoreceptor that is situated into the carotid area, so called as carotid body peripheral chemoreceptor, and another one is aortic body, the area where this peripheral chemoreceptor is situated. So this is the location of this both receptor and the stimulus, how or in which condition they basically activates. कब ये activate करेंगे, कब ये काम करेंगे? So guys, very important, the chemoreceptor which can detect oxygen, CO2 and the H ion, that is the pH maintaining condition. Guys, out of this the most important stimulus for this peripheral chemoreceptor, that is none other than your oxygen level. So whenever in your body oxygen level drops down, guys, this sensor will be activated and they will send this message to the brain, to the medulla, and medulla immediately will increase the respiration. So this is the strongest stimulus. अगर ये नहीं होता ना बेटा, तो अपनी बॉडी के अंदर अगर ऑक्सीजन कम भी जाती तो भी अपने ब्रेन को पता नहीं चलता, और अपने लंग्स की जो स्पीड है वेंटिलेशन की वो बढ़ती नहीं. सो टू इंक्रीज द वेंटिलेशन ऑफ द लंग, बेसिकली this sensor is actually helps. They detect the level of oxygen in the blood. Whenever the blood oxygen level drops below 60 mmHg, they immediately activates and they send the message to the medulla. They can also stimulated by CO2 and H ion. So if the in MCQ question is saying all are the condition which can be detected by the peripheral chemoreceptor except, so you should know that oxygen level, CO2 level and the H ion, they all can activate the chemoreceptor. But if the question is asking main activator, strongest stimulus by, the answer is oxygen. So please remember this condition, right? Number next, nerve supply. As I told you, the carotid body the area where this carotid chemoreceptor is situated, the carotid body, it is connected by the herring nerve, and this herring nerve is actually the branch of the glossopharyngeal nerve, right? This is the branch of glossopharyngeal nerve. The aortic body, where this actually the aortic chemoreceptor is situated, this is connected via the vagus nerve, and this is the vagus nerve which is going inside of the medulla, right? Action. So whenever this sensor, as when I just now told you, whenever this sensor will be activate, they send the message, they increase the ventilation. Guys, please pay attention. They increase the ventilation and also they increase the sympathetic activation. Guys, if the sympathetic activation will be increased, what will be happen on the heart? अगर हार्ट पे सिंपैथेटिक एक्शन आएगा, what will be happening? The heart will also increase its rate. So heart rate will be increased, BP will be increased, right? So very important concept about this peripheral chemoreceptor, and please remember they respond to the hypoxemia. Talking about the central chemoreceptor, so like the same way, like this peripheral chemoreceptor, like in the same way, one more chemoreceptor is situated, and this situated inside of the medulla. And this inside of the medulla, this is the area where all the respiratory and the cardiac center is actually situated. Guys, so the location of this central chemoreceptor is ventrolateral medulla. Stimulus is H ion, which is present into the CSF, not in the blood, that is in the CSF due to the CO2. So please pay attention, guys, please pay attention. They do not directly respond to the hypoxemia like the peripheral chemoreceptor. Basically, central chemoreceptor is stimulated by H ion or the CO2. But the peripheral chemoreceptor, they activate by the oxygen level. So this is the question where you have to be very much careful, right? So direct stimulus is H ion, but overall stimulator is CO2. So mechanism, whenever the CO2 cross the blood-brain barrier, it forms the H ion in the CSF, and then it stimulates the medulla and ventilation is increased. So the main driver of the respiration, please remember, that is your CO2. So main driver of respiration is CO2. Let's talk about the another receptor, that is baroreceptor. Baroreceptor, please pay attention. This is the pressure sensor. Chemoreceptor was the chemical sensor. Baroreceptor was the pressure sensor, and the pressure is actually present into your arteries. So whenever the pressure will be high into the arteries, artery will be stretched up, and when the pressure will be low, artery will be relaxed. So this is how the baroreceptor is actually detects the changes of the arterial side. Guys, please pay attention. Baroreceptor basically detect the stretching into the vessel and mainly especially in the artery, right? And this actually tells about the BP changes. This baroreceptor, they function very rapidly. They immediately identify the pressure and they immediately fire and they immediately do the changes in the pressure. So that's why they're known as a rapid BP regulation receptor. What we call this? Rapid BP regulation receptor, and they act within second. Please pay attention, like in the same way like the chemoreceptor, दोनों एक दूसरे की sisters हैं. Like this you can remember, both are the sister, दोनों बहनें हैं एक दूसरे की बेटा, right? तो please pay attention, जो chemoreceptor होता है वो भी aorta के अंदर situated होता है. Like the same way, the baroreceptor is also situated into the aorta, and another baroreceptor is situated into the carotid artery. And that's how the aortic, this is we called as aortic baroreceptor, and this is we called as carotid baroreceptor. Got it? Like the same way, the chemoreceptor this is connected by the brain, it is also connected by the vagus nerve, and this is connected by the glossopharyngeal nerve, right? Glossopharyngeal nerve. Now, please pay attention. So, location, if we'll talk about the baroreceptor, just now I told you, this one baroreceptor which is situated into the carotid area in the carotid sinus, and another one at the aortic arch, right? Now the stimulus increase the stretch, lead to increase the BP, right? This is the most important stimulus, and the nerve which is supplied by that carotid sinus is supplied by the herring nerve. This is your herring nerve, which is the branch of the glossopharyngeal nerve, and the aortic arch, this is connected by the vagus nerve, right? Vagus nerve. If we'll talk about the reflex, so whenever the BP will be increased, right, baroreceptor will be fire. This firing will go into the medulla in nucleus tractus solitarius. NTS means nucleus tractus solitarius. Nucleus tractus solitarius is the area. So this firing will go into the nucleus tractus solitarius. This will activate and this lead to activation of the parasympathetic condition, and parasympathetic lead to decreased heart rate, and it will also do the vasodilation, which lead to decreased BP and the decreased heart rate. So you can see it lead to decreased heart rate and the vasodilation. And this lead to what? This lead to decrease the BP. Guys, if the baroreceptor stop firing, what will be happening? If the baroreceptor stop fire, this parasympathetic stimulation will be stopped, and who will be activated? There will be activation of the sympathetic, and if the sympathetic will be activated, guys, what will be happening? There will be a tachycardia and the vasoconstriction ultimately lead to increase the BP, right? Not decrease, increase the BP. So if BP decrease, everything will be opposite. Like this way, everything will be opposite, like there will be tachycardia and the vasoconstriction. But suppose if the BP increase, then there will be decreased heart rate and there will be vasodilation. So this is how your BP basically regulates in the very short manner within few seconds, and this is all due to the baroreceptor. So this is thank you for this baroreceptor जो अपनी बॉडी के अंदर होता है बेटा और इस तरीके से अपने बीपी के प्रेशर को मेंटेन करता है, right? Now, so you can see over here that suppose if somebody is doing the massage over here, अगर कोई बाहर से यहाँ से मसाज करे तो what we are doing, actually we are pushing this carotid area. If we are pushing this carotid area, carotid artery will be compressed and the stretch on this carotid artery will be increase. And if the carotid artery stretch badhega, so what will be happening, guys? This nerve will be fire, it will go into the medulla and ultimately it will activate the parasympathetic, lead to decrease heart rate, decrease vasodilation. और बेटा इस प्रेसिंग को अपन बोलते हैं, इस प्रेसिंग को अपन बोलते हैं कैरोटिड मसाज. So that's actually we do in the PSVT, पैरोक्सिमल सुप्रावेंट्रिकुलर टेकिकार्डिया. क्योंकि अपने को इस हार्ट को स्लो करना है. स्लो करने के लिए क्या करना पड़ेगा? मैसेज यहां से भिजवाना पड़ेगा, राइट? मैसेज यहां से आएगा वाया द पैरासिम्पैथेटिक एक्टिवेशन, और उसको कौन करवाएगा? बाय दिस रिफ्लेक्स. तो ये इस तक मैसेज पहुंचाएगा, ये आगे जाके इस हार्ट को स्लो डाउन कर देगा. सो दिस इज ए टाइप ऑफ ए रिफ्लेक्स, राइट? आई होप एवरीबडी इज नाउ अंडरस्टूड द बेसिक कॉन्सेप्ट बिहाइंड दिस chemoreceptor and the baroreceptor. Very important part. So let's summarize both of this receptor. So for the chemoreceptor, the sense is oxygen, CO2 and the H ion. For baroreceptor, the pressure or the stretch of the vessel. The chemoreceptor main role is it control the respiration, but baroreceptor it control the BP. Who can fastest get what is the fastest stimulus for the chemoreceptor? That is the level of oxygen. Whenever the oxygen level drops below 60 mmHg for the blood, this receptor will be fire. About the baroreceptor, guys, it stimulates by the increase the arterial pressure, right? So whenever the arterial pressure is high, what will be happening? It will ultimately lead to activation of the parasympathetic, lead to decreased heart rate, lead to decreased BP via the vasodilation, right? Mainly, chemoreceptor is located into the carotid and aortic body, and the baroreceptor is located into carotid sinus and the aortic arc. It's very important concept this is. Now, how the question can be asked in the various examination, in various MCQ, in which language actually the question can be framed out. So let's practice few MCQs related to the chemo or the baroreceptor if you understood all the concept, right guys? तो अभी तक मेरे को लगता है बेटा कि सब लोगों को अब ये दोनों के रिसेप्टर समझ में आ गए होंगे. बहुत इंपॉर्टेंट रिसेप्टर हैं, you should never miss it out. Okay, so the first MCQ, let's practice for this part. A mountaineer rapidly ascends to the high altitude and develops hyperventilation. The primary receptor responsible is, guys, first please understand the MCQ. Talking about the mountaineer and going upside at the high altitude area, we know that whenever you are going upside at the high altitude area, the level of oxygen drops down. जितना ऊपर जाते हैं ऑक्सीजन का लेवल कम होता है. So what is happening? the less oxygen going inside the lungs and less oxygen mixing into the blood. And if the less oxygen into the blood, guys, the chemoreceptor immediately identify it, because just now we talked about chemoreceptor basically detects the level of oxygen, and these chemoreceptor will be fire. They will send the message into the medulla, and medulla will send the message to the lungs, and lungs start ventilating at the higher rate. So this is how the primary receptor responsible is peripheral chemoreceptor. So answer is B, peripheral chemoreceptor responding to decreased PaO2, right? Another MCQ. A patient with the supraventricular tachycardia is advised to do the carotid sinus massage. The mechanism of slowing heart rate is, just now we discussed, if the PSVT is there, supraventricular tachycardia is there, so in SVT basically you slow down the heart. How you can slow it down? या तो आप ब्रेन से मैसेज भेज दो या हार्ट के अंदर डायरेक्टली जाके और आप हार्ट को स्लो डाउन कर दो. तो व्हाट यू कैन डू, without any invasion, guys, you can simply send the message via the brain. And how you can send it? Via doing the carotid massage over here. So just now the concept I told you, if you will do the carotid massage, pressure is detected by the baroreceptor, and this baroreceptor will be fire, will send message to the medulla, and medulla ultimately decrease the heart rate via parasympathetic activation. So it increase, answer is C, increase baroreceptor firing causing vagal activation. Next question is, a surgeon accidentally damaged the glossopharyngeal nerve during neck surgery. Which reflex abnormality is most likely? So guys, we know glossopharyngeal nerve, it is having the connection from the carotid area for the chemo and the baroreceptor. So guys, what will be happening? Pressure cannot be detected by this condition cannot be told to the brain by this carotid area, and oxygen level can also be not able to send this message into the brain because the glossopharyngeal is actually gone. So what is happening? There is the loss of hypoxic ventilatory response from the carotid body. Right answer of this question is A. So this is how the question can be framed out from this chemoreceptor and the baroreceptor part. So guys, I hope that the concept behind this chemoreceptor and baroreceptor is clear in your mind. If you like this video, please like and share, and do subscribe my channel. So I am also available on the Telegram and the Instagram. So you can get it my QR code on this video. So kindly share with your friends and understand this concept of the chemo and the baroreceptor. Guys, thank you very much.